Measuring blood pressure is a critical part of managing a wide variety of health conditions. That's why doing it accurately is so important. One factor that affects accuracy, and is often overlooked, is the performance of automated blood pressure monitors on individual patients.
Automated blood pressure monitors need to be clinically validated in at least 85 patients before they can be marketed, but this doesn't guarantee their accuracy on an individual patient. We found that some automated blood pressure monitors are accurate on some patients, but inaccurate in others. We suspect this is based on a particular monitor's algorithm and whether or not that one is suitable for that particular person.
Unlike weight or height, blood pressure is usually measured indirectly. Algorithms are designed by blood pressure monitor manufacturers to estimate blood pressures. Different manufacturers develop different algorithms that are proprietary.
There are many variables that affect the validity of individual blood pressure estimation, including arterial compliance, blood pressure level, arm composition, and arm shape. No manufacturer can factor into his or her algorithm corrections that will ensure blood pressure accuracy for all patients.
American Heart Association publications recommend validation on each individual patient before a blood pressure monitor is used for hypertension management. That means to compare the device readings with auscultatory blood pressures and to check if the difference is acceptable. Auscultatory blood pressure is traditionally measured with a blood pressure cuff and a stethoscope. The medical professional uses the stethoscope to listen to the cough sounds from blood flow during cuff deflation.
This type of validation seldom happens in practice because it's a time-consuming process and requires significant resources. The process might take 15 minutes in an individual. Given that recent guidelines recommend home blood pressure monitoring in most patients, individual validation of every home blood pressure monitor would bring a big burden to the healthcare system. An affordable and simple tool is needed to expedite this process, and Accutension Stetho is a potential solution.
Accutension Stetho is the world's first individual person validator for automated blood pressure monitors. It can help people check whether a specific device is accurate on each patient. The Stetho's components are a stethoscope and a software application that runs on a smartphone. When a patient's blood pressure is measured with an automated blood pressure monitor, the stethoscope records the sounds of the blood flow, the cough sounds, and the phone camera video records the cuff pressure from the blood pressure monitor screen. The sounds and the cuff pressure are synchronized on the phone screen. In the app, the cough sound signals are visualized as cough sounds generate spikes. When the marking line is manually placed on the first and last cough sounds, the corresponding cuff pressure is the auscultatory blood pressure. Comparing the auscultatory blood pressure with the blood pressure displayed on the automated blood pressure monitor, the accuracy of the automated device can be evaluated.
I have helped develop clinical blood pressure validation methods for over 30 years. These have led to the United States national standard for clinical validation of automated devices. The U.S. now uses the international ISO standards, on which I serve as a U.S. representative. With Accutension Stetho, almost anyone can validate an automated device. This can be done by physicians or even by the patients themselves. If the patients are not sure of their precision, they can email the record to their doctor to do a remote validation. This greatly simplifies the validation process and makes validations on every individual feasible.
Using it couldn't be easier. Simply put on your blood pressure cuff, Velcro the Stetho's head onto the inner side of your elbow, and plug one end into your smartphone. Next, select Validate in the Accutension Stetho app and start your blood pressure machine, focusing the video screen on it from your smartphone. Once the numbers begin to decrease as your cuff deflates, press the Record button, keeping the numbers on the video screen within the app. Once deflation stops hit the record button again to stop the video recording, and you're ready to determine your precise, accurate blood pressure. Take a moment to slide your finger along the progress bar, and you'll see the exact cuff pressure that corresponds to the sound recorded by the stetho. The higher number, the one that's visible when the first sound appears, is your systolic blood pressure, and the lower number, the last number you see just after the sound stops, is your diastolic blood pressure. If you're not sure about the sounds, insert a headphone jack into your cell phone and press playback to listen to the sound yourself to double-check and adjust the marking line if necessary. Comparing the auscultatory readings with the automated readings, you will be able to determine the accuracy of the device.
I can imagine many applications of the Accutension Stetho. It can be helpful when an automated blood pressure monitor is selected for blood pressure measurement. When a person selects a blood pressure monitor, a pharmacist can use the Stetho to help select a monitor that's accurate on that person. This person can have higher confidence to use this blood pressure monitor to manage his or her blood pressure. They may need to validate the blood pressure monitor periodically to make sure the algorithm still works well for him or her when there is a change in the body or particularly in the artery conditions like gain of weight, which may increase the arm circumference. The person can bring the Stetho to his or her doctor's office, and a healthcare professional can use the tool to do a quick validation for him or her. If the person can be taught to recognize Karatkov sounds, he can do it themselves. He can also mail or email the record to his doctor to perform the validation remotely.
The American Heart Association and American College of Cardiology published new hypertension guidelines last year. According to the new guidelines, almost half of Americans have hypertension. The grading of hypertension is now more aggressive, so the importance of accuracy is more critical than ever.
Based on the new hypertension guidelines, less than 120/80 is considered to be normal blood pressure. 130/80 or higher is grade 1 hypertension, and 140/90 or higher is grade 2 hypertension. The new hypertension guidelines require higher accuracy of blood pressure to correctly classify hypertension appropriately. Accutension Stetho is a valuable complementary device to today's automated blood pressure monitors.